Okay, so here's an interesting study looking at treating wear and tear knee osteoarthritis with a medication called methotrexate. So this study is originally from the UK. They took several different clinics and they basically took a little over 200 patients. They split them up. Half of them got methotrexate, which is a immunosuppressant medication that works on inflammation, and the other half they gave placebo. This was a double-blind, placebo-controlled study. That means is that both the physicians and the patients were unaware of what the treatment was that the patients were receiving. And what they did was they basically followed them for 6 months and then checked to see how much better did they do in terms of pain in the knee, stiffness, and function. And what they found was that the treatment that received methotrexate they had a modest but significant improvement in their symptoms as compared to the placebo group, which had no improvement in their symptoms. So interesting for a few reasons. The first thing is that for rheumatologists, we generally think of arthritis as, do you have wear and tear arthritis, which is more instability and weakness in the ligaments that eventually causes stress in the joint and the bone, causing wear and tear arthritis. Then you've got autoimmune arthritis, where you've got conditions like rheumatoid arthritis and psoriatic arthritis, where your immune system is so active, it starts causing dramatic inflammation throughout your body and then even damaging the joints, causing dramatic progressive damage. So in this study, and so usually methotrexate, which works well in conditions like rheumatoid arthritis and psoriatic arthritis, does not work so well in wear and tear arthritis. That's the typical thinking for rheumatologists. This study suggests otherwise. So interesting, because maybe there is more to inflammation in wear and tear arthritis than what we sometimes recognize. So we know that there is some degree of wear and tear arthritis in knee osteoarthritis, because when you take fluid out from the joint, for most people with knee osteoarthritis, that level of inflammation in the joint will be fairly normal, like it won't be high. But there are some patients with knee osteoarthritis where when you take fluid out, you'll find that there is some inflammation. It's mild, but it's there. It's not like a rheumatoid joint or psoriatic joint where it is like 10 out of 10. It's more like a 3 out of 10, right? So there's some inflammation. And that's why this treatment was working on these patients probably. The other thing is, the traditional ways of treating inflammation and wear and tear arthritis are to do things like anti-inflammatory medications, ibuprofen, Advil, Aleve, and to utilize steroid injections. Those treatments work short term. The problem is that they have a lot of long-term side effects, and it's not really healthy for the tissue. Methotrexate, while appropriate if you've got a condition like rheumatoid or psoriatic arthritis that can cause devastatingly bad arthritis and disease, is probably a bit overkill in this case, because it does have some potential side effects. So then the question is, what else can you do that does not require medication or treatments that are possibly more risky in the setting of wear and tear arthritis? Some basic things, for sure. Number one is, if you're not already taking the appropriate over-the-counter supplements, things like omega-3, glucosamine, and turmeric, you need to be doing that. Those help with pain and inflammation in the osteoarthritis. Next, you have to work on your metabolic health. That means that if you're not already eating a low inflammatory diet, you have to be doing that. If your metabolic health is not correctly controlled or on point, you're more likely to get inflammation, which can then cause inflammation in the joints and more pain with wear and tear arthritis as well. So fix that as well. You have to do that. And if that's not enough, then you consider regenerative medicine treatment. So treatments like prolotherapy and PRP are great at treating instability by strengthening the ligaments. But there's also regenerative medicine treatments that can also help with inflammation in the joint as well. There's things like alpha-2 macroglobulin and interleukin receptor antagonist protein, which are really good for treating inflammation in the joints. You get those from your blood. You can also get those same things from your own bone marrow, as well. So along with stem cells, you can also get some of those anti-inflammatory elements as well. So my takeaway is interesting, methotrexate, helping the setting in the osteoarthritis. But I think there's other ways to treat inflammation, and I really would not go this direction if you haven't already tried those other options, because those options normally help, and they're lower risk, and they're safer, and they're better for you as well.